Hello everybody, Q&A Wednesday night. It's Dr. T here. I hope you're doing really well. I've had a really amazing week and I want to show you, I've got to just give a massive shout out to my beautiful colleagues who work with me at Womb. I just want to show you what they bought me for my birthday. I'm so excited. I've got these beautiful earrings. Can you see them? Are they beautiful? They're so pretty. And I also got this gorgeous care pack from our gorgeous Brooke, who makes gorgeous candles, smelly candles. I'm so sorry that you can't smell this, but check this out. She's made these gorgeous soy candles. This one's grapefruit. So yum. Candles by Brooke. Check it out. And she's got me some beautiful, what are these called? The scent sticks that you pop in here. Subtle Glow Candle Company. This one is a citrus splash. So that's really cool. I got that. And I got some yum. I think this is toffee. This is the sort of thing that I would sit and just eat all night long. This is apricot and pistachio, bramble and hedge. So yum. My fave, dark chocolate. Love a bit of dark chocolate. And a beautiful, and I'm so heading for this later, rose bath soak. Check that out. This is by subtleglowco.com as well. So good. This is a total care pack. I'm totally doing some self-care. I don't know if it's going to be tonight, but it's definitely going to be sometime in the next 24 hours. Candles by Brooke. So yummy. Yeah, that's for me. Me. So I get to enjoy that later. And these beautiful earrings. So yummy. All right, we're actually here to talk about blokes today. I hope you guys have sent in some questions about blokes, men's health and fertility, because I can't tell you how many women come into my clinic and say, what can I get my husband to do in order to improve our chances? So there's been a few questions that have come through, and if you do have anything else, drop it in the chat today. But I wanted to talk about men and lifestyle because it's often an area that is quite under addressed, because a lot of women I see will walk into a clinic and express that martyrdom, okay, doc, what is it that I have to do? Tell me what treatment I have to go through, what tests I have to go through. And they kind of put it on like a coat of armor. Yeah, I'm ready. And in fact, about 15% of what I see in the fertility space is actually male related. So male fertility issues. And it can be really quite confronting for a guy who kind of just walked in there thinking that he was along for the ride to actually be someone's asked about the effects of drinking alcohol. I am so going to address that, Amy. Remind me, I'll come back to it if I forget. But it actually is really confronting for a guy to know that he's the cause, or certainly a large contribution to why a couple might not be conceiving. One of the tests, or actually the main test that we look at for a bloke, is the semen analysis. And if the semen analysis is considered to be within the fertile range, then that's pretty much all that we care about. So what do we look at when we're looking at a semen analysis? Well, the most important marker is really the concentration. How many sperm does a bloke have per mil in an ejaculate? Well, Ashley's asked about T3. I'll come back to that too if I remember. So concentration is really important. So the World Health Organization has developed the guidelines. This is released in 2010, and the numbers are based on what is considered to be the top most fertile group. So anything that is out of the range is the less than 10th centile of men in the cohort that they analysed. And so concentration should be at least 15 million sperm per mil. Ideally, the volume of an ejaculate should be 1.5 mils or greater. So sometimes if a guy has a really huge volume, but not necessarily a lot of swimmers, the concentration will be low, but the total sperm count will be within normal limits. The other important parameter that we look at is motility. About 90% of sperm that is ejaculated into the top part of the vagina will actually get caught in the cervical mucus and go no further. That is a normal finding. So if you don't have a very good concentration, or they're not very motile progressively forward, and most of them get stuck into the cervical mucus, you can imagine that a lesser and lesser proportion of sperm is actually going to make it all the way into the tube, which is where conception actually takes place. So sperm concentration and sperm motility is really important. Now, ideally, you should have at least 32% of the total sperm being progressively motile forward. You can have 90% of them motile, but if they're just swimming around in circles, they're of absolutely no use to us. So we need them to be swimming forward. So progressively motile is the number that you want to be considering. Another really important parameter that we look at is the morphology, how they look under the microscope. And the World Health Organization says you need a morphology of 4%. That means that 96% of sperm can actually look really abnormal, and you can still have what is considered to be a fertile sample. Amazing, isn't it? But then if you think that you've literally got millions and millions of it, then having such a low morphology is actually pretty reasonable. Another really important parameter that we look at is the presence or absence of antisperm antibodies. Now, and someone asked a question on this, these antibodies, generally boys are not born with this. It is something that is acquired, and it's often acquired due to a break in the blood-testis barrier. The sorts of things that can do that include trauma to the testis, perhaps in a sporting injury that might end them up in hospital, not just a little kick to the groin in the playground, but something significant that ends them up in hospital. It might be post-vasectomy, if a man has undergone vasectomy and then vasectomy reversal. Sometimes you can have the development of antisperm antibodies. But generally it's due to a breach in the blood-testis barrier, because if you think about it, the sperm are actually seen as foreign because they only have half the number of chromosomes than you see in all the other cells in the body. So it makes sense that the immune system would then go, that's not normal, therefore I'm going to mount an immune response, and antibodies actually develop. Now those antibodies can then attach themselves to any part of the sperm, the head, the centromere, which is the center point, like the mid-piece, or it can attach, most importantly, to the tail. And when it attaches to the tail, it can then affect motility. So sometimes if a man has reduced motility, we'll go and look for antisperm antibodies. And if you've got greater than 50% of the sperm that have antibodies, then that significantly reduces the number of sperm that reach the egg that are going to be able to actually fertilize the egg. If you've got antibodies on the sperm or the the head or the mid-piece, then again, that's going to affect the ability of the sperm to actually fertilize. So antisperm antibodies are significant. What can you do about them? We can't make them go away. They are there. They're part of an immune response. You'll continue to produce antibodies to sperm as long as you have an immune system reaction. And how we overcome that in the world of fertility is we use ICSI treatments. So we actually take a sperm that doesn't have any antibodies attached to it, moves normally and looks normal, and we inject that into the egg itself and overcome the impediment to fertilization. So we use that within the realms of an IVF cycle. So that's another important parameter that we look at. We also look at viscosity. Viscosity is kind of the stickiness of the semen. We don't really know a lot about what causes increased viscosity. We know that it can be an impediment to the sperm actually swimming out of the semen. We also don't really know how to treat it. There's been some studies that suggest giving anti-inflammatories, or it could be due to dehydration as well. But it is a parameter that we don't know very much about. One parameter that we do test, but not all fertility centres test this, is DNA fragmentation index. So DNA fragmentation is measured. There's a number of different tests that we can use. We use something called SCSA, SCSA. And what it is measuring is the amount of DNA damage that is in the genetic material within the sperm. And so you can get that measured as a percentage. Other studies, tunnel, halo, have different percentages. So there's lots of different types of tests, and there is varied evidence as to which is the best to be using. But there's our centre, we use a SCSA. And so if you have a group of sperm that has a high level of DNA damage, the thought is that will actually impact on potentially fertilization and pregnancy rates. What causes increased DNA damage? Well, every single cell in the human body is exposed to free radical damage due to metabolism that happens in the body. And sperm that is sitting in the epididymis, ready to be ejaculated, is particularly susceptible to free radical damage and therefore oxidative stress, which we measure as DNA fragmentation. So high DNA fragmentation means high oxidative stress. Now you can get a high DNA fragmentation index by the fact that sperm is simply been sitting there for a long period of time being bombarded by these free radicals. So if you have a man that perhaps hasn't ejaculated for 10 days, then that sperm that has been sitting there is subjected to high levels of free radical activity and therefore oxidative stress. So one of the things that we suggest to men is to actually increase the frequency of ejaculation, particularly within a assisted reproduction cycle or assisted reproductive treatment. We get men to ejaculate on a more frequent basis to reduce the amount of oxidative stress in sperm. Something else that we might suggest to men is to be taking an antioxidant to counteract the impact of free radicals. Now, this is quite a controversial area because the research at this point in time doesn't necessarily support the use of regular antioxidants for men, particularly men who have high DNA fragmentation. But it is not uncommon for you to see a man who has had high DNA fragmentation who then commences on an antioxidant preparation and his DNA fragmentation will decrease. What particular antioxidant preparation we should be suggesting remains unknown. There's a big Cochrane review study that is being done looking on a whole range of different antioxidant preparations, and the problem is that they're all different. They all have different combinations of vitamin C and vitamin E and selenium and magnesium. So we don't know what combination, we don't know what dosages, and we don't know for what length of time. It would make sense that given that we know that the lifespan of a sperm is around about 3 months, that a man really should have these antioxidants in his system for a good 3-month period of time to impact enough of an effect on the DNA fragmentation for it to be clinically beneficial. Has anyone really measured that in any great studies? Well, no, because the best measure of outcome would be live birth, but then we've also got to take the woman into consideration. So it is a really controversial area. My thoughts on it are this. An antioxidant preparation is really unlikely to be causing any significant level of harm, and it may just do some good, particularly in the context where a man has actually been shown to have a reasonable level of DNA fragmentation in the sperm. But I'd also be looking at all the other things that can cause oxidative stress in sperm. So what are the sorts of things? Well, we know that illnesses can lead to increased oxidative stress. So if a man has diabetes, for example, if a man has sleep apnea, so he's relatively hypoxic, not getting a lot of oxygen in, so if you've got a bloke who snores a lot and maybe even stops breathing at night time, then that's certainly going to increase the risks of DNA fragmentation. A man who's overweight or obese. Now we know that fat is inflammatory. I've talked about this ad nauseum with regards to egg quality, but we know the same is true for men. Obesity affects it both from fat being quite inflammatory, but fat also can be quite hot, and if he's got a bit of a panis, a bit of a spare tire around his waist, and it can kind of overhang the testis, then that can cause a lot of heat, and that can also cause increased oxidative stress as well. Men who have varicocele, so a big dilated swollen blood vessel in the scrotum itself, you can ask a bloke, he'll often describe it as a sack of snakes that he can feel himself. That causes hot blood via the testis itself, which heats it up and therefore can cause oxidative stress. Certain medications, because the body has to metabolize and process them, these medications can increase oxidative stress as well as the conditions that they are treating. So there's lots of things in lifestyle. Now, there are also toxins that men consume that can increase the amount of oxidative stress or free radical activity in the human body. Alcohol and smoking are two of those. So it's really important for us to not only address the issue of alcohol consumption in women, because we know there's no lower limit of safety of alcohol consumption with women, we need to address the same in blokes. So, and I would say this to anybody, that a man really should be drinking no more than 2 standard drinks every night, should not be binge drinking, and a binge drink is anything more than 4 standard drinks in one sitting. So unfortunately, a guy cannot save his 2 from every night and have them all on Saturday night, and that's 14, so 2 standard drinks over a week per day. He can't save them all up and have them on Saturday night, because that binge drinking will also cause a significant amount of oxidative stress. Cigarette smoking, the byproducts of nicotine, the other chemicals in cigarettes, THC, marijuana, same. All of those things will increase the amount of oxidative stress and therefore cause increased DNA damage to the sperm. Certain medications can also affect the motility of the sperm as well. So it's really important to sit with your doctor, fertility specialist, and decide whether or not certain medications can be continued for blokes or not. So that's kind of a look at lifestyle. The other thing to consider with men is age. Now, I know we talk a lot about the impact of a woman's age on the outcome, and as a woman ages, pregnancy rates decrease. Well, as a man ages, pregnancy rates can decrease as well. Not only that, but the rate of autosomal dominant conditions increases as a man ages, particularly beyond the age of 50. But when you look at the research around pregnancy rates and men's age, we start to see a dropping off in pregnancy rates when a woman has stayed the same age but a man is getting older, from about 45 years of age onwards. So, girls, age in a bloke matters just as much as it does in a woman. And if you've got a woman and a man who are both in their mid-40s to late 40s or even 50s, this is kind of the perfect storm, because you've got an aging of both the eggs and also the sperm as well. So age does matter for a bloke. I know we all hear the stories of the 70-year-old man who fathered a child, and that's certainly possible, but it is age certainly of a man certainly does impact on outcome, but also the increased rate of autosomal dominant conditions. One of the most common we know of is achondroplasia or dwarfism. What else? What other questions were asked? So I hope I've answered the alcohol question. We've talked about antioxidants. We've talked about sperm motility, common factors affecting male fertility from a lifestyle perspective. We've talked about antisperm antibodies. I don't know if there are any other questions that have been asked. Someone asked about T3. T3 is not something that is commonly prescribed in mainstream for managing hypothyroidism. Usually we use pharmaceutical grade levothyroxine. So there would be no evidence. So I don't know that I can really answer that question on the safety or the efficacy of conceiving on T3, unfortunately. Sorry about that. Hopefully that has answered everyone's questions. I don't think I saw any other questions pop up here. If there are any more questions about male health, throw them in the chat now. Oh, someone asked me a question. What if you find that a man is azoospermic, i.e. having no sperm whatsoever? It's important to figure out, is it a production issue? Is it due to the brain not stimulating the testis? Is it due to the testis itself failing to produce sperm? And there's a condition known as Sertoli cell only, where the sperm cells are not actually there. And the Sammy, I'll come and answer that question in a second. And the other thing, is there obstruction? So has a man, for example, had an infection that has led to the sperm not being able to get out through the pipes? So what we do as fertility specialists is we sit down and we run a series of hormones to see, is it the brain that's having to work overtime, so therefore the testis has failed, or is the brain not working as much as it should be, and therefore the testis itself is not responding because it's not being stimulated. So they're the kind of three areas, and also obstruction. So looking for any history about infections, or even doing some imaging to see if there is any cause for why the sperm might not be able to get out. Sammy's asked a question, is it true that the drop-off in embryo development from day 3 to blastocyst is attributable to sperm health? No. No, that's not true. I think I might have addressed this in the last Q&A last Wednesday, but what actually happens is when the egg and the sperm fertilize and create the zygote, which is sort of the early development phase, the egg itself provides all of the inner workings. So there's lots of little organelles in the egg that provide the powerhouse for that early embryo to be developing. And the sperm contributes the DNA, and then all the other components of the sperm are kind of ejected from the zygote. So then you've got your 2 pronuclei. Now, yes, it is true that in those first few days, it's the inner workings of the egg, the little organelles, that provide it with the energy for it to divide. Once you hit day 3, or cleavage stage rather, the embryonic genome itself kicks in. And that's when it becomes its own entity. And so if it's not normal genetically, or if the components of the cells themselves are poorly functioning, like the mitochondria, for example, that's the point in time when you often get a grinding to a halt. And it's safe to say that you end up with around about 60 to 70% of embryos will do that, such that you get a significant drop-off at around about day 3. But it is not due to sperm health. It is possibly due to a combination of egg and sperm. It could be due to it being of abnormal chromosomes, of which the majority of this comes from the egg, just simply because it's been there for a long period of time. But yes, you can get sperm aneuploidy as well. So no, it's not attributed to the sperm itself. Someone's asked the question, why does the embryo make through the blastocyst, perhaps? Is it due to egg or sperm? I'm not quite sure, Mia. I don't really understand the question. But I wonder if you're talking about the blastocyst. So the blastocyst is day 5, when you've got a nice little inner cell mass developing. You've got a blastomere, which is this kind of cyst, fluid-filled sac. And then you've got the trophectoderm around the outside, which ultimately goes on to form the placenta tissue. So it's really starting to differentiate itself. So I don't know quite what your question is, whether you're asking, is it the egg or the sperm that make it get to that? Well, it's a combination of both. It's the embryonic entity itself that helps it get through to that stage. Sadly, we still have some embryos that make it through to day 5 of their development that aren't chromosomally normal, and will go on an implant and then will demise a little later on. So unfortunately, we can't say that just because it gets through the blastocyst stage that it is okay, because as we all know, we still have miscarriages which happen after the time that an embryo has actually implanted, and we've got a positive pregnancy test. It's I think it's one of life's cruelest jokes, really. To have implantation and you think you're on your way, and then unfortunately it doesn't continue. It's a really hard journey. So to all of those of you who've had a miscarriage out there, I've had my fair share, then my heart goes out to you, because I know how hard that journey is. Well, guys, if there are no more questions, I thank you so much for joining me tonight. It was a bit of a light night tonight. I thought I might get a few more questions about men, given how many people sit in my office and ask me about what their men can do to improve things. But look, the reality is you guys know the answer to these things. It's about looking after the temple, whether you're a man or whether you're a woman. We've got to look after this temple of ours in order for us to have it function to the best of its ability to achieve the things that we want it to achieve. And for blokes, that's absolutely no different to women. So have a beautiful rest of your week. Don't forget to go and check out Candles by Brooke. So nice, the grapefruit one. And how beautiful is this container? Look at it. I don't know if you can see it, but it's this beautiful cut glass. Can you see that? So pretty. Have a beautiful week, guys. See you soon.